I'm pleased to be able to be with you, even if it is through this electronic media.
I actually heard of Kathyn and her work before I even knew I was coming to Seattle. She looked at me over the top of her glasses and said, where have you been? I've been waiting for you.
Hello, I'm Dr. Kathyn Barnard, Professor of Nursing at the University of Washington, and I'd like to take this opportunity to very personally introduce you to the NCAS classes.
Kathy and Georgina Sumner started NCAS programs on this very deep desire to bridge academia and practice.
Georgina and Kathy together were quite a formidable pair as advocates for mothers and parents.
Before the internet, before Skype, before distance learning, Kathy set up a virtual classroom.
You will be learning actually how to assess as you observe parent-infant interaction.
I loved working with Kathyn. The first time I ever met her, she talked about how infants couldn't wait.
I'm sure you've heard, babies can't wait.
Infants can't wait.
Infants can't wait.
Babies can't wait.
I welcome back Dr. Kathyn Barnard, Professor of Nursing and established researcher in child development, whose studies of preterm infants have helped shape nursing practices everywhere.
Kathyn and Barry were great friends.
She said, value passion wherever you find it. And I thought, what a wonderful insight.
I'm not sure she even herself realized the impact her thinking had on just about everything we did in the field, not only of child development for kids who are developing typically, but for kids who are vulnerable.
When I first got to know Kathyn, I realized her office wasn't in the School of Nursing building, it was in the Center for Human Development and Disability.
She loved having her space here, and she loved having opportunity to be with interdisciplinary colleagues.
To me, that was a sign that she was more of a citizen of the campus, and I mean that in the best possible way. She brought nursing as an ambassador would to many of the other disciplines on campus.
I think that what Kathyn Barnard did was very much aligned with the spirit of this school that really tried to identify the talents and really support them and nurture them so that they eventually become impactful scientists.
She inspired me to continue to pursue a career in nursing because she exemplified for me a nurse scientist who was innovative, passionate, and creative in her thinking.
She would call us all together, all the staff, and she would have us discuss, well, should we do this? What should we do? And then we would all come around to the idea kind of independently that this is something that we should do. And then it turns out she would have a stack of paper next to her, and she had assumed that we would do it.
She always influenced you in some way. Either you recognize it right away, or was planted in your unconscious somewhere, and you would do exactly what she said, maybe not an hour later, but certainly a year later, because of the power of her arguments.
I wish you great success and hope that what will be continuing today is a process in which we can march together, finding some ways in which we can both make our teaching more effective and have more fun in the process. So thank you and good luck.